Let's bring in our health care reform panel again, this time to talk about choices in the Senate plan. Professor Kenneth Thorpe chairs the Department of Health Policy and Management at Emory University. Eamon Javers, financial correspondent for Politico.com. Two sharp minds on this. Professor, let me start with you. I want to get to the exchange in a moment, but we also know there are provisions here. It's called a health care co-op. Please explain that to me so that it makes sense not only to me but for everyone watching.
Well, all a healthcare co-op is, it's a not-for-profit health plan. The management of it is run by its membership. There are no profits, obviously. I think the intent is to make sure that all the decisions about how the health plan operates really are in the best interests of its members. So it's quite different, obviously, than a for-profit health insurance plan in that respect.
Okay, and the idea of the exchange that we're hearing about, and Josh just explained a little bit of the language. Drill down a little deeper on that for us. What do we mean by this exchange?
Think of it just as a marketplace where people who are in small businesses or self-employed can actually go to the internet or go physically and actually sign up for a coverage. So it's a way to provide information to people in a very simple way. It basically performs the same function that your employer at CNN or mine at Emory would play for me in terms of a health benefits department.
Yeah. What, if anything, does this plan do, the Baucus plan? What does it do to stem the rising cost of private health insurance? What are your thoughts on this?
Well, I think it does a couple of things. One is that it reduces the cost of administering our healthcare system. They're certainly moving in the right direction to try to streamline claims processing and other things that we can just cut out of the system, a lot of the paperwork. Two is that by having Medicare assume some leadership in doing a better job of preventing disease and managing chronic illness, the key drivers of healthcare spending increases, the thought is the private sector will adopt some of those approaches that the Medicare program is going to use. So I think that at the end of the day, there's something in this in terms of cost containment, both for the public plans as well as for private health insurance.
Overall, generally speaking, where are we today? How significant is this point in time in the evolution? Look, 60 years we've been trying to do this as a nation. How significant a day is this?
Well, I think today is probably the biggest day we've had in 60 years in health reform. We've had bills passed out of the House. We've had bills passed out of the one Senate committee, and the Senate Finance Committee, the big committee doing this, is going to report hopefully out next week. So this process has gone far further than we did 16 years ago. And certainly I think that we are closer than ever to having comprehensive health care reform that really will improve the quality of care for all Americans, really take a lot of the anxiety out of people worried about losing their insurance coverage, being denied coverage, or having a health insurance plan drop you when you're sick.
All right, Professor Thorpe, thank you for your time. And I should mention you were there trying to make this happen 16 years ago with the Clinton administration. Thanks for your time. We really appreciate it over the last 2 hours.
Oh, thank you.
And our apologies. We lost Eamon Javers. We will certainly be talking to Eamon about this over the next couple of days.